Hello, everyone. This is Dr. Allison Hull, and welcome to Wellbeing. We are a tribe planted with purpose, and you will learn quickly as to why we call ourselves a tribe planted with purpose. And we thank you for participating on this virtual open house. Given the climate of COVID today, everyone has to kind of adapt, and this is an example of that. But I have to say, no better time to really focus on an opportunity to really focus on our well-being during a time like COVID, where we really realize how important it is to optimize our health and disease prevention. So you guys are at the right spot at the right time, so we can help you guys prevent multiple disease processes, including COVID. And we're excited to share this program with you. And as you see here, we are a complete wellness transformation program. We are way more than a weight loss program, and I know there's many of you on this other end here that are listening right now for numerous reasons, and we're going to hopefully share with you all the benefits that you can experience going through our program. So, as I mentioned, we are incredibly grateful to have you here, and this picture exemplifies a portion of our tribe. So each of you will support a piece in our growing mission to improve as many lives as possible. Myself and my phenomenal team could not do this without the entirety of the tribe. It takes an army to move mountains, and when we're talking about changing lives and making that sustainable, it absolutely requires a team of people. So you will be a piece of this success.
There may be a small technical glitch. I see some of you cannot see the slides. I'm apologizing for that. I think it may have something to do on GoToWebinar's end.
So we're going to keep moving forward, and worst case scenario, then you guys will receive this webinar via email.
Yes.
So next, we're going to talk a little bit about myself and the rest of this phenomenal team. So I'm going to tell you a little bit more about me and my background and why we are here today. So once again, my name is Dr. Allison Hull, and I am a dual board certified adult internist and pediatrician. And I've been practicing medicine outside of residency now. This is my 11th year. And I can tell you that the longer I practice medicine, the more I focus on disease prevention, because it's so vital in order to take care of my patients. And I get so much more excited about getting rid of medications rather than adding more medications on for my patients. So I am the medical director and the co-creator of Wellbeing, a tribe planted with purpose, and we established this program in 2018. Prior to working with Florida Medical Clinic, I was chief resident with USF in my combined program of internal medicine and pediatrics, and I finished that residency in 2009. I completed my medical school training at Des Moines University, and then my undergraduate degree is food science and human nutrition. So you can see I've always had a passion for nutrition, but what's so interesting is what I promote, preach, and encourage today is extremely different than what I was taught in my undergraduate education. And you guys will quickly learn why I say that. And then I also serve on the board of the Foundation of Caring for Florida Medical Clinic, which we have a nice connection with our program and the Foundation of Caring that you'll quickly learn about. And then lastly, I bring this up, I guess partly because I'm proud of it, and I think what we're doing today with this program is a great example of why I earned this award in 2009 when I finished my residency. I'm a member of the Golden Humanism Honor Society, and I received this recognition because of my focus on humanistic patient care. And those who receive this award are thought to be role models and mentors and the leaders in medicine. And I would like to think of myself as that, especially in this world that we live in today and trying to lead others to better preventative care. So next, I'm going to introduce you to Kim Chisholm, who is our beautiful nutritionist, registered dietitian, who also happens to have a master's in public health. And Kim is also one of the co-creators of our program.
Hi, everyone. It's so nice to meet all of you virtually, and hopefully we'll be meeting you in person soon. Welcome, and we are so excited that you're here. I am honored to be a part of this program. I truly love working with each participant and really helping guide them toward using food as medicine. And as Dr. Hall mentioned, we've learned so much, through the years of experience of working beyond our training, and we've really come to discover that prevention is absolutely key. And there's so many ways that we can do that. And nutrition, of course, is one of those primary means. And so I love to focus on that part, especially. I have served in a couple of different roles. I've worked in clinical settings within hospitals. I've also worked at the University of South Florida as the campus dietitian, which was a lot of fun. And also surprising, though, to see how many young people had so many different conditions, everything from hypertension to type 2 diabetes or pre-diabetes, polycystic ovarian syndrome, just many things that I wasn't quite expecting to see. And that kind of put me on the route toward focusing on prevention, using nutrition as that primary tool. And then I've worked in other settings as well, but that was kind of the beginning of really beginning to see that prevention is so key. Working with participants, or I shouldn't say participants, back then it was students, one-on-one, I would give them nutrition counseling, and I started to notice there were other environmental factors that were influencing their eating. It wasn't as simple as, just follow this plan. We had to think about social circumstances. We had to think about finances. We had to think about many factors that were influencing them. So this opened me to a route of really looking at the bigger picture and what influences our eating habits. And now I'm part of this program, and we bring a comprehensive approach to you where we talk about nutrition, sleep, stress, physical activity to really help you begin to have healthy habits that will stick for life. And so we will use food as our medicine and move away from medications and look to reverse various conditions and really put you on the path toward being well, not just getting healthier, but really being well and living life to its fullest. So I'm honored to be a part of the program, and I look forward to working with each of you.
Thank you so much, Kim. And next I'm going to introduce Kelly Matthew, who is I always say this, the glue who holds us all together, and I'll just let her introduce herself.
Hi, everybody. I'm so glad to be here today. This program is my third child, as Dr. Hull will also confess as we move through the program. And I'm so excited to be able to share all of this information with you tonight. I wish we could be together in person because I love seeing the faces as we go through these slides and share with you what we have seen happen with this program. My background is in community health and mainly corporate wellness and program design. So I love that my worlds kind of come together here with the employees at Florida Medical Clinic, as well as all of you with this program to really change the trajectory of your health. I have been a graduate of developing lifestyle and physical activity programs at the Cooper Institute. I was a presenter at the Healthy People 2010 conference in Washington, D.C. One of my favorite parts of my job is health coaching. I'm a certified intrinsic health coach, and we're going to talk more about that throughout the program. And I can't wait to see you all in your coaching journey. So I'm glad you're here, and I will be available for questions via email when we're done with this if you have any questions.
Thank you, Kelly. And then next we have Mindy Hudson, who has a background in nursing. She's a registered nurse and our newest team member. So I'm going to let Mindy introduce herself.
Okay. Hello, everyone. My name is Mindy. I want to welcome each of you this evening. I'm so excited that you're able to join us. Like you can see on your screen, I am a registered nurse and a health coach with the Wellbeing Program. And I've been doing this for almost a year now, so I am the newest member. So let me just tell you a little bit about my background. I graduated with my Bachelor of Science in Nursing from Middle Tennessee State University. My experience includes working at Moffitt Cancer Center, Tampa General Hospital, also worked for Hillsborough County public schools, managing 4 different clinics, elementary and middle school. So that was a ton of fun. And I currently teach various classes right now for Brandon Regional Hospital, and I work with the wellbeing team. And I just want to say, I absolutely love everything about this program. I truly believe in the science of this program, and it's amazing to see the transformations. And the changes really speak for themselves. They speak volumes, which I know Dr. Hull and Kelly will go into later. And then on a personal note, I have been married for almost 20 years, and I have 2 boys. One is, will be 15 next month, and the second, he is 6. So we have a little bit of a gap there. That's how we like to do it, but it's lots of fun, and they keep me very busy, which I love. But I want you guys to know that as both a nurse and a health coach, I'm committed to not only providing you with, of course, the knowledge, the tools, and the resources that you need to be successful, but I'm really focused on building relationships. That's my favorite piece, and giving you the support that you need to reach your goals. You know, we really want you to feel empowered and know your purpose, truly getting healthy from the inside out. That's what this program is all about. And also, I work with participants. If you have like a complex medical condition, you know, such as diabetes or hypertension, using our protocols and recommendations with Dr. Hull, I'll help guide you and answer your questions and ensure that you make changes in a safe way. I love being a part of this tribe. I look forward to getting to know each and every one of you and seeing your beautiful changes.
Thank you so much, Mindy. So you can see here that we have a pretty cool team of people put together to help you guys through this process. And I'm going to speak on behalf of this next individual, Kelly Crowe. She is the cognitive mindfulness coach that we utilize throughout the program. She actually has a master's in mental health counseling and a bachelor's in psychology with over 20 years of experience. And those of you who are my patients listening, you probably have heard me talk about her before, because I do highly recommend her for both individual therapy as well as group therapy and workshops that she does with our program. You know, really, guys, that everything starts with how we think and feel, and therefore, you know, that's going to dictate how we behave. And kind of starting the program with changing our mindset is the key to long-term success. And Kelly is instrumental in helping us achieve this with you guys. So she's an absolute asset throughout the program. And then lastly, we have Gina Leffert, who is our certified personal trainer. We will have 6 weeks of fitness training that's offered in the live class. And Gina is our wonderful athletic trainer, personal trainer that we use. And she's been with our program now for 2 sessions, and you'll get to meet her on Saturday mornings. And she's just also been a tremendous asset. And what's really neat about Gina is she actually has a background in physical therapy. She worked as a physical therapy assistant for 8 years. So when you're talking about the need for modifications with exercise, she is our girl. She can help any person at any level of fitness training reach and achieve goals, no matter where you're at, because she can help you modify. So she's fantastic, and I'm excited for you guys to get to know her. All right, so I love this quote here, and this is really kind of a lovely foundation of our program. The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. So this is by Thomas Edison, and this quote was kind of guesstimated to be written in 1903. And, you know, I think he was at the time, you know, this was obviously over 100 years ago, he was saddened by the state of the kind of medical care at that time. And I can only imagine how appalled he would be today that we don't focus more on prevention, that we don't utilize nutrition as much as we should. And so this was kind of prophetic over 100 years ago that he would be using this quote today, which is really the mainstay of why we created Wellbeing, a Tribe Planted with Purpose. So I want to go into more detail about the 12-week program that we are offering. And while we say the word or words 12 weeks, it's really, guys, it is far more than that. And you will quickly learn why. Once you go through our program, you're kind of with us indefinitely if you so choose. But the first 12 weeks are the very intense portion of the program, and it is here that we teach you the why and the how of optimal living. When we know why we are to do something, we're much more inclined to follow through. And then, of course, it's one thing to know why to do something, but another to know exactly how to do it. And we hold your hand throughout the process. We offer a systematic step-down approach to lead you to optimal nutrition. And guys, we have perfected this program over the last 2 years, and we're constantly changing, modifying, improving. And what we're going to be offering in this next program is a little bit different than the ones in the past, simply because we've learned and modified, and we're trying to always optimize what we're doing. You'll quickly learn that the program offers 2 nutritional paths: a low carbohydrate or a ketogenic living track. And some of you might be saying, what the heck is that ketogenic living? Or on the other flip side, some of you are like, I know exactly what that is, and there's tons of information out there. But I will admit, you guys, there's a lot of people doing it the wrong way, and we are here to help you do it the right and healthy way. So here is our program schedule. Week 1 is starting line measurements and identifying the ideal human diet. Yes, we like to kind of get a starting point measurement for your own sake, so you guys can see where you're starting from and then how things change over time. And it's really neat to see, you know, the weight and the waist circumference and blood pressure changes that take place. And then just over 12 weeks, how radically things can change. And here we also focus on the ideal human diet. You know, there's so much discrepancy today in what the ideal human diet is, and so many varying opinions. And you know, there's certainly one study will say we should eat this, and the next study says we should eat that. So one way to kind of really better determine what we should be consuming is, let's look at what we consumed on planet Earth for millions of years and what allowed us to become the dominant species on planet Earth. So we take a look back in time and really rediscover what our ancestors ate and allowed them to thrive. And shouldn't we be eating a similar diet? Week 2, we move into goal setting and gut healing foods. And this is where we really start that change in mindset. There is so much science behind how we think, and we can learn how to, I use the word manipulate a lot, but that somewhat has a negative connotation. So we're going to use the word strategize. We're going to teach you the strategies to think differently, to create reward mechanisms to help push you forward and to sustain that momentum. So there's so much we can teach you in the science of psychology, and that is where we focus here on week 2. And we couple that with gut healing foods, because believe it or not, the gut and the brain are intimately connected. And if we start kind of merging those two worlds together, we'll have much greater results long term. Week 3, mastering detours and debunking the mystery of our dietary guidelines. The detours are key, right? So let's think about why we eat. We eat because, yes, we're hungry, but way more than that. We eat because we're happy, we're sad, we're bored, we're stressed, or simply out of habit and or addiction. So here we really focus on how do you change behaviors with food and utilize other modalities to kind of fill in that blank of happy, sad, stressed, etc. But this takes practice. This takes strategy and counseling, and that's what we're here to do for you guys. And then we couple that with the conversation of this food pyramid that has been hanging around for quite some time, and it's just rubbish. This food pyramid that has been guiding our dietary guidelines for many years now should not exist. And we kind of peel back the layers of why that information is incorrect and biased and teach you what the actual food pyramid should look like. Week 4, we talk about nutritional ketosis. This is where we break down the science of nutritional ketosis. And to simplify it for you guys quickly, nutritional ketosis is essentially a metabolic state in which you utilize your fat as your own energy source. And that's why a ketogenic diet is so effective for weight loss, because you literally turn yourself into a fat burning machine. In order to have this success, though, we must really reduce carbohydrates and keep our protein within moderation. Otherwise, it won't be effective. And there's a lot of people who think they're doing a ketogenic diet. And I have patients come to me all the time and saying they're doing a ketogenic diet, but they're really not. And we guide you on your specific macronutrient guidelines, those carbs, proteins, and fat, based on your your ideal body weight and your height and your sex. So we will hold your hand through that process. Week 5, we hone in a little bit more, differing between the low carb and the ketogenic eating track. So listen, you guys, a low carbohydrate diet has tremendous benefits. You don't have to follow the ketogenic track in order to have success. And we like to use this week to really kind of differentiate the two, talk about the pros of either path, and then with kind of knowing your goals and what your long-term aspirations are, and kind of also coupling that with your personality type, we try to help you decide which track is right for you. Neither one is better than the other. We just have to kind of meet the track that fits your goals, your expectations, and your personality type. Week 6, we move into tracking and navigating your plan. So this is where we really teach you how to, use the applications and weigh, count, measure, track your food, make sure we're hitting those macronutrient goals. How do we live life going to restaurants and events related to food and still stick to our eating plan? So we really kind of go into detail in that week 6. Week 7, we talk about fasting, and I do really like this week. I do love the fasting component. It is a great tool to help you all be more successful and kind of also create some kind of better habits related with food. And so we break down all the kind of different definitions of fasting, alternate day eating, time restricted feeding, prolonged fasting, and we talk about how this can be used as a catalyst for you to achieve your goals. And I have to digress for 1 second. My father, who's 71, he has lost 45 pounds in the past year strictly by doing time restricted eating. So he follows, I said, Dad, and he was pre-diabetic, and I'm happy to report he is no longer pre-diabetic, and he's lost 40 pounds simply by minimizing the time window in which he eats. And as a result, he just finds himself, eating less and craving less foods. And to the point where I said, Dad, are you doing okay? Like, I'm a little worried you're still losing weight. And he said, I'm just doing what you told me to do, and I'm doing the time restricted eating. So anyways, it's a great tool. And if all you do is walk away with that tool in your tool belt, you will have success. Week 8, we talk about moving for life. This is where we incorporate fitness into the equation. And listen, you guys, there's going to be a spectrum of where you guys are on the fitness scale. Some of you are already avid exercisers and doing great. And some of you, it's hard to, maybe walk 100 feet. I don't care where you are. We're going to meet you where you're at, and we're going to get you moving more despite where you're at right now. Week 9, stress, sleep, and balanced living. So vital, so important. I wish we could talk about this sooner. In order to optimize your health and well-being, and yes, be successful in weight loss, we really need to sleep. And a lot of us have disordered sleeping patterns, insomnia. We, put sleep last on the list. And I'm here to tell you, we are going to help you change that, and you're going to feel so much better getting optimal sleep every night. Week 10, this is just a fun class, cooking class with tastings, and this is for our live class. And this is a class where we show you that you don't have to be a master chef. We can cook things that are very healthy, very simply, very affordably, and we'll show you and demonstrate that. And you get to eat some tasty food in the process. So that's just a fun night. And then week 11, we talk about food as medicine, food as thy medicine. We go back to that quote by Thomas Edison, and we really, we help you see how food truly is nourishment. We look at salads as being this sacrificial process of, I'm foregoing the pizza at lunch so I can eat this salad and I'm hating every minute of it. No, we are here to change your perspective on that. We're going to reframe the salad into a bowl of nourishment and joy and longevity, and we're going to teach you how to think that way because of all the beautiful, bountiful benefits of healthy food. And then lastly, we're going to finish you off with finish line measurements and leading the way. This is where we repeat those measurements and you see how far you've come in just 12 weeks. It's pretty phenomenal. And then we're going to give you the tools of how to live life sustainably moving forward. That once we cut that umbilical cord of being in class with us every week, we can teach you that you can still sustain these new habits lifelong. So it's a great week for people to feel encouraged and confident moving forward. And then, as I mentioned, you never really have to leave us because we have the ongoing program. And this is, once again, we're constantly evolving, and we've discovered through the last 2 years that this ongoing piece is so vital for everybody's long-term success. I mean, there's tons of research that shows in order to create a sustainable behavior change, we need accountability, we need support. This is where we get to show up and continue to have our relationships together as a tribe, which is so vital for everybody's long-term success. So the ongoing program will include group meetings once a month, opportunities to assist with future live well-being participants. And you might be thinking to yourself, what does that mean? Opportunities to assist with future live well-being programs. So what has happened is people get so vested in our tribe, in the program, that they want to continue and play a role of leadership in some capacity, or at least just have a role that helps them stay connected. Completely voluntary, but it is really neat to see how people want to stick with us long term. And then we have access to the wellbeing workshops with Kelly Crowe. That's our licensed mental health counselor that I talked about earlier. And then you still continue to get your health coaching sessions once a month, which is so vital for behavior change. Once again, this health coaching piece is really significant, and Kelly and Kim and Mindy can speak on this even more, but tons of research on health coaching, especially this intrinsic motivation type of health coaching that helps you reach your goals. And then of course you get the ongoing Facebook communication. That is a private Facebook group I haven't mentioned yet, but everyone within the tribe going through the program, we have a private Facebook group that only those going through the program can utilize, and it's a great tool, once again, for support, accountability, troubleshooting, and we have found it to be very effective. So next we're going to have one of our graduates share their experience with well-being, and it's not just James, but his wife, his son, who he'll hopefully share a little bit about. And James, can you share with us a little bit about your experience with well-being? We're having just a moment here.
Here we go. Okay, I had to take myself off of mute. You can hear me?
Yes.
All right, great. Hi, Dr. Hall. Hi, everybody. Okay. So I've been a patient of Dr. Hall since about 2012, I believe. And Dr. Hall, you could probably correct me on that. And for the past 20 years, I've spent the majority of it over 200 pounds. And just to give you an idea, because you can't tell from the picture, I'm only 5'5". So that puts me in, the obese category, well within the obese category. And, I've had just a lot of struggles, with weight, as I'm sure a lot of you have as well. I have a pretty stressful job too. And, I was drinking to reduce stress on the weekends and in the evenings, and, eating pints of ice cream and whatever else. Just not very good. And Dr. Hall, I told her maybe about half of what I actually did. Not on the drinking, I was honest with that, Dr. Hall, but the eating, I'm not sure I was always honest about. And, she would tell me what I needed to do and all. And finally, I listened to her in September of this past year, or 2019, and I went ahead and Juanita, my wife, and I joined the online version of the wellness program. So we did the webinar, and it was good. I actually lost some weight and started feeling good, but I'm not the best student. I kind of dropped off in the end. Work got crazy again. And so I said, all right, I need to do this for real this time. And so we got my parents to watch our 4 kids, and we both went down for the January session. And excuse me for a second. So I just want to say, in between there, Kelly, I believe that's when it was, Kelly and Matthew helped out a ton. She reached out at the end of the webinar version, asked how we were doing and everything. And I think she was the reason why I decided to go on and do the second round. So anyways, I've lost 48 pounds at this point, and this is from 243, that's where I started in September. And the 243, again, another probably lie, because it was just when I knew I was bigger than that, I just chose not to get on the scale. So now I fast 16 to 20 hours every day. That's kind of the thing that I hold on to. And I do keto, I would say 95% of the time. There are, we have a birthday party and I'll have a little bit of something or whatever, but it never feels great. And realistically, berries are my treat now. That's like when I want to have a cheat day, I put about a cup of blueberries into the blender and toss a little bit of cream in there, and I have my little fake ice cream, no sugar added. So one of the things that I think I got out of this experience more than any was how we can impact other people's lives. So Juanita has lost 29 pounds. I've lost 48. My dad has started fasting and he's lost 20 pounds. My mom's fasting. She's lost a little bit of weight. I don't actually think she needed to, but she says she feels much better. And she was actually getting into the pre-diabetes numbers, so we're waiting for a test back on that to see how she was doing. And then there was actually this weekend, so I've noticed a lot of big changes in my son. So my son has also lost about 20 pounds, just kind of watching. He joined us at the wellness classes and on. So he's lost some weight too, which is just really great. But I've just recently started seeing major changes beyond just the weight. My weight's kind of been stagnant, but I'm fitting into like medium-sized shirts instead of extra large and stuff. And my neighbor texted me the other day because he saw me sitting out by the pool, and he was like, I didn't even know who that was at first. He's like, wow, you've done a great job. You look like you're back in wrestling shape. He said, what's your secret? So I wrote him a book. I told him what we've been doing, what were the big things for me, and I did not hear back from him, not a thing, days. And yesterday I got off of another stressful day at work, and I came inside and Juanita said, Doug's out there walking. And I said, no kidding. So I went out there and talked to him. I ended up, after my 2-mile run yesterday, my 5-mile walk I did, and all the other stuff that I do every day now, I went out and walked another 5K with him and talked and told him about, the struggles I'd had and what I did to lose the weight. And so, having an impact on somebody else, it just kind of, now I can't gain that weight back. What am I going to look like? I just.
Right. It helps you.
Say again?
So that helps you be accountable, right, James?
Oh yeah. No, the accountability is big. And like I said, I have 4 kids. I mean, and I'm creeping up on a big age number. And I don't really, I want to be healthy for the end of it, for the rest of my life. I want to see the kids, the grandkids grow up and, maybe even some great grandkids as well. We got good genes in our family. So this has been great. Kelly's been awesome. Dr. Hull has always obviously been awesome. The whole group is really great. And I believe that because of all the COVID stuff that Juanita is actually planning on coming for this next round, and trying to kind of get the last little bit in person, and I'll probably stay home and watch the kids. But yeah, I'm under 200 pounds, and woo! I feel like I can actually be a normal weight by the end of the year. That's my current goal. So.
I love it, James. Thank you so much, James. And, obviously you put the work in. It doesn't happen without you working. And I love that you've had such an impact on so many people around you. And that's really what we love best. And that's what motivates myself and Kelly and Kim and Mindy and everybody else in the team, that we know that when we improve one life, we're actually impacting numerous others because of it. And, you know, he hit the nail on the head too when he talked about Kelly. You guys, the team of that we have here, they are so passionate, so caring. It is such a unique opportunity to have these individuals who truly are so vested in each and every individual, and we celebrate every triumph. So absolutely, James, thank you so much. So as far as the disease processes that we get to kind of watch evolve in patients going through this program, we've just kind of hit the highlights of there's more than this, but let's just kind of talk about these ones in particular. So absolutely prediabetes, which is essentially elevated blood glucose readings. And James had mentioned about his mother, and then of course I mentioned about my father. And the results that I see with my patients is unbelievable. Those with prediabetes and also type 1 and type 2 diabetes. We see dramatic shifts in A1Cs and blood glucose levels, reduction in medications, which is wonderful, but also requires close monitoring in the process. We see tremendous improvements in blood pressure. And that's as a result of not just the weight loss, but the change in diet, reduction in stress, improvement in sleep, increase in activity. All of those components together help reduce someone's blood pressure. We see an improvement in lipid levels. So this is your cholesterol screenings, and most specifically the triglycerides are where we see the most radical change. Essentially, high triglycerides are a result of higher glucose levels. When glucose doesn't have anywhere else to go, it likes to hang out in the liver and produce triglycerides. The triglycerides are then the precursors of the LDL and the VLDL cholesterol. We also see a pretty significant improvement in the HDL, which is the good cholesterol. The evidence shows that a low carbohydrate diet in conjunction with high fat and lots of green things and exercise will raise your HDL. This is the good cholesterol. There's actually a higher risk associated with heart disease with a low HDL than there is with a high LDL, which is typically the cholesterol that gets all the blame for cardiovascular disease. So we see improvements in these lipid profiles, which absolutely can reduce your risk for cardiovascular disease. Guys, fat is not the enemy, sugar is, and we are here to better educate you and guide you on that. We see significant improvements in gastroesophageal reflux disease, otherwise known as GERD. Many patients are on medications that are called proton pump inhibitors, which is Prilosec and Protonix and Nexium. And for many years, this medicine was given out, I hate to say it, kind of like candy or a vitamin. And guess what? Similar to many medications, now we know that to be on one of those medicines long-term has potential significant adverse side effects, including low magnesium levels, renal dysfunction, dementia even. So we do not want to stay on medicines that just put a Band-Aid on reflux. Guess what, guys? When we improve our diet, lose weight, we can significantly improve reflux disease without medications. Next, we have here fatty liver disease. So we're actually looking at some CT images, pre and post programming on some of the participants who have fatty liver disease to see the impact that the program has on just this diagnosis. We're still in the midst of analyzing all this data, so more to come on that. But I will tell you, with my patients, and when we have them go through the program, they lose the weight. We see a reduction in those liver enzymes that are typically indications of inflammation of the liver related to fatty liver disease. And fatty liver disease can lead to cirrhosis of the liver. We do not have to be an alcoholic to develop cirrhosis of the liver. It can be a result of fatty liver disease. And then next we talk about abdominal bloating, dyspepsia, irritable bowel syndrome, that just, I don't feel good, I'm always bloated. I hear this all the time. And of course, I've been there too, in my years before eating the way I do now, that chronic, just like bloated, not feeling good. And once again, when we put the healthy things into our gut, it responds back to us and says, thank you. And a lot of these symptoms are mitigated. And then last on this list here, we talk about osteoarthritis, joint pain, low back pain. So I'm going to be honest, by no means am I saying that going through the program and losing weight is going to be the cure-all for chronic osteoarthritis and chronic back pain. If you have lumbar disc disease and bulging discs, you're going to have some pain regardless, potentially. But when you take that extra pressure off of your back, for every 10 pounds we gain, that equates to 100 pounds of pressure on your back. So with weight loss, we're going to minimize that pain. We're going to minimize that joint pain in our knees. And one participant in particular who has done phenomenal. A few years ago, she went, because she was having such horrible knee pain, she went to the orthopedist, and because she was hoping to get some type of surgical intervention because her knees were so bad. And his response was, I'm not going to do surgery on you until you lose weight because it's not safe. Well, I'm so proud that this individual has lost about 75 pounds, now is running 5Ks, mud runs, leading all of us in exercise. And guess what? She has had no surgery. And I can't wait for the day she goes back to this orthopedist and says, I don't need your stinking surgery. Thank you very much. Next here we have a reduction of certain forms of cancer. And let me explain this. Now, it's not going to reduce our risk of every form of cancer, but there's multiple forms of cancer that are linked to something called insulin-like growth factor. When we reduce our carbohydrates, we reduce our insulin levels and therefore reduce a byproduct of that called insulin-like growth factor. And this guy is a fuel source for many forms of cancer. So I'm not going to say we can reduce our risk of every form of cancer, but certainly multiple types. Cognitive function and memory. Your brain thrives on ketones. Glucose is actually inflammatory, and people think we have to have glucose for our brain function and brain energy, but I'm happy to report you do not. And there's so much growing data looking at dementia and Alzheimer's disease and utilizing a ketogenic diet, and even the positive benefits of a low carbohydrate diet with cognitive functioning. Next, migraine headaches. Migraines are now starting to be looked at more so a disease process that's a result of energy deficiency within the brain. This is why if you guys suffer from migraines, you know that if you skip a meal, it could trigger a migraine, or certain types of foods can trigger a migraine. Lack of sleep can trigger a migraine. And a lot of that has to do to the disruption of that energy service to the brain. And once again, when you have a constant fuel source of ketones going to the brain, you're never energy deficient. And therefore, it is a great mitigator for migraine headaches. Now, we are hesitant with our patients who have chronic migraines to push the fasting piece, okay? And we'll talk about that through the program, but definitely a low carb or ketogenic, we can see improvements. Neurodegenerative diseases like MS, Parkinson's disease, there is definitely research showing how low carb and ketogenic can be beneficial. Once again, it reduces inflammation, it optimizes the nutrition to the brain. Chronic inflammatory conditions, asthma and allergies, you know, the nidus of most disease processes is inflammation. And when you change the way you eat, you can help reduce that inflammation. And then autoimmune disorders like rheumatoid arthritis and psoriatic arthritis. Once again, I'm not going to guarantee or promise that this is going to put these disease processes into remission, but is it going to help reduce some of that inflammation? Absolutely. Chronic mood disorders, depression, anxiety, PTSD, even bipolar disorder. You know, there's a much higher risk for depression and anxiety in those individuals who have obesity, prediabetes, diabetes. And of course, the question is, you know, which came first? But by improving the nutrition, helping you lose weight, we can definitely see an improvement in these chronic mood disorders. And then sleep deprivation and insomnia, we really help guide you on how to develop better sleep hygiene and how to overcome some of this insomnia that so many people are plagued with. I see it all the time in my practice, and we can actually utilize some techniques to help you guys sleep better. And then obstructive sleep apnea. Now, this is, of course, if your obstructive sleep apnea is a result of your body habitus being overweight with weight loss. I see it a lot. I have patients who utilize the CPAP machine and then they lose weight, and guess what? They don't need the CPAP machine anymore. And then last but not least, weight loss. And we purposefully put this one bottom of the list because while many of you might be listening right now because your goal, your primary, your only goal is weight loss, what happens is you go through the program and you see so much positive change that is not related to weight loss, that the weight loss just happens to become the positive byproduct. When you have better confidence and energy, you're sleeping better, your joints hurt less, all of a sudden the weight loss is not as meaningful. So now, guys, we're going to take another pause and we're going to hear from another graduate or graduates, Melissa and Edward, who we affectionately refer to as Mel Word, because that's how they refer to themselves. And they've been patients of mine for quite some time. So Melissa and Edward, please share.
Can you guys hear us?
Yes. Hi, guys.
Hello. First of all, I just, it really is about your mindset. It's not really, well, at least for me, it was about my mindset, because it's really easy to, to look at something and like walk away from it, but then you think about it like, oh, I just walked away from that piece of chocolate cake. And then you think about it and you dwell upon it. And like for me, it was the mental part of the program was the most difficult for me. And I didn't even know like what my purpose was or my why or stuff like that. And this program really opened up my eyes. And, I think Edward as well can agree with this. Like, we discovered our purposes, we discovered our whys and incorporated them into our daily lives, and was able to, differentiate what's important, what's not important. Like, are we gonna, go for a 15-minute walk, or are we gonna watch an hour movie on Netflix? You know what I mean? Also, this program really changed our eating habits as well, because obviously both of us have really high demanding jobs. I'm a teacher. Edward works for T-Mobile at a call center, so he's not very active. He's sitting all day. And for me, it's there's always birthdays and kids are bringing in treats and donuts, and can't say no to those. But this program really like helped me more to say no. And it's not worth it. Like, eating the garbage is not worth how I feel afterwards. And we did attend the workshops with Crowe, and we did do vision boards, and we met Matt Botts and his wife, and they were like two of our favorite people throughout the whole entire 12-week journey. And it's funny because I think Dr. Hull had mentioned, you'll meet your best friends, in these shops, and like we did. Like, it was just crazy how everything happens. And I know Dr. Hull also mentioned how the program is laid out, and I think now, having done the program, it really is laid out the perfect way, how it needs to be. And if you just get through the mental part of it and just stay focused and stay geared, you really get what you put into the program. So if you don't put what you need into the program, you're not going to get the results. If okay, you're supposed to only eat this many carbs this day, and you're not supposed to do this, but you need to exercise, if you don't do what you're going to do, you're not going to get the outcome you want. So it really is putting in what you're doing to get the results you want. So, that's all I have to say. What do you want to say, Edward?
I agree with everything that Melissa says. This program, honestly, it opens your eyes to everything that we were taught, as we were growing up. What pretty much,
about the food.
Yeah, the food, the way that we were taught what food is good for you, what we're supposed to eat, what the pyramid says that we're supposed to have the most of and the least of, all controlled pretty much by the education that we received. But in reality, that's not good, because you're going to see as you go through the program, all of the things that are easy for us, they're made easy for us, but they're all truly bad, but they're just making money off of us. So I just feel like opening up our eyes. Dr. Hall was like the first doctor that I've ever had that was like, no, you shouldn't have the medicine. I don't want to prescribe you things. And in the picture, you can't really see me too much body-wise, but I'm 5'5". I was getting close to 200, and I was like the highest that I've ever been in my life. It's pre-diabetic, high blood pressure, pretty much everything on those last two charts. I had maybe half of those things. And now going through the program, I feel so much stronger, so much better, losing more weight. I was having difficulties losing weight, and me just finding information online on, oh, this is what I need to do to lose weight, This is a little glimpse of keto, and they teach you everything, and they put you on the path so you could lose the weight and it stays off of your body. It's not just going to come back. I mean, unless you just go really off course and go straight into the bad habits. But I feel like now I'm more in control of my health, and I'm continuing to get to the places that I want to get when it comes to health, and passing that information to everyone around me, and passing it down to family and the future, so we could reverse everything that everyone was taught, and eventually everyone will learn what we're learning, to spread that out to the world, so it could correct all these diseases that were just created from bad habits of food.
Well, thank you guys so much. And what I love that you commented on, Melissa, is the relationship piece, that you became good friends with another couple throughout the program. And I think that's something that people join without any expectation, and it's just kind of this beautiful extra reward on the side. But the relationship piece is lovely, and I'm so glad you hit on that. And then I also love that you hit on the fact that you will see the results based upon what you put in, and that's 100% right. Like, we can feed you all the information, but we would be naive to say that through osmosis this is going to happen. So we need a state of mind that says, I'm ready for change, and good things will happen. All right, thank you guys so much. So as we talked about, and actually it's great because the graduates have mentioned this whole purpose thing and this why thing, and you've heard them sprinkle it in a little bit in their testimonials. And this is where it all begins, and this is why we are a tribe planted with purpose. We as humans are capable of anything when we have a purpose, a reason why. And you can see our vision here: ignite the purpose of one to transform the well-being of many. So we were able to help ignite that purpose for James, and you see the wake of the change that took place around him. Another participant I think of, she and her family, only one person went through the program, but as a result, she's lost 75 pounds, her daughter lost 100 pounds, her son-in-law lost 100 pounds, her father lost about 40 pounds, and her mother lost about 20 pounds. So she was the only one who went through the program, but she made dramatic changes in the people around her. And that's all because we help you ignite your why. And some of you might be sitting here thinking, well, that seems kind of deep. I'm just talking about a weight loss program. Why do I need to think about my why? When it comes to long-term success, we need to have a deeply rooted reason. A number on a scale is not enough. And so that's where the coaching, the psychology, the cognitive training comes into play, and we're going to help you with that. We want to teach you to use coping mechanisms other than food. So every week we practice a new mindfulness exercise, and we talk about mental imagery, progressive muscle relaxation, diaphragmatic breathing, meditation, cognitive behavioral therapy. So when you walk away in 12 weeks, you have this arsenal of weaponry that you can use to protect you and help you deal with life much more effectively. And then the connection piece, the relationship piece, as I've already hit on. The tribe is so vital. We all help each other. And I love on the Facebook page, one person will be having a bad day, they'll have a slip up, and everybody just completely jumps in to support, encourage. We talk about being vulnerable. There's so much research on how important it is to be vulnerable in order to have more success and joy and stronger relationships in life. Very different from being shameful. And we are a safe place to allow yourselves to be vulnerable through we of course have our group meetings in class, and then the health coaching piece. We also put you into teams if you so choose, and you have a mentor. It's tons of layering of different relationships to help you be successful. And then we also like to highlight the impact that your efforts are going to have on our community. So we have started this process that for every pound you all lose, I personally make a donation to our Foundation of Caring. And in addition to that, if you guys complete certain activities and do your final measurements, I also kind of throw in extra donations. But thus far, I'm so proud to say that we have donated $7,923 to our community through the FMC Foundation of Caring, all because of your success and effort. And I'm going to just quickly show you the different organizations that have been impacted because of the tribe members making changes in their life. A Kids Place, Pasco County's Women's Shelter, the Volunteer Way, Thomas Promise, Starting Right Now, Stay in Step, On Bikes, Cornerstone Family Ministries, the Volunteer Way, Echo of Brandon, One Community Now, and Veterans Alternative. You guys get to play a role in changing the community as you improve your own health and well-being. It's a piece that we really do love, and you guys get to help pick which organizations we donate to. So next, we're going to switch gears again, and we're going to hear from Richard. He is going to share his testimonial with us. And wow, Richard, look at your before and after pictures. This is phenomenal. Can't wait to hear from you, Richard. Hi, Richard.
Hi there. Can everybody hear me?
Yes, sir.
All right, wonderful. Well, I'm going to be reading my testimonial because I wrote it. So I'm just very, very thankful to have this opportunity to share my testimonial with you all, and hopefully it will be very encouraging. So let me go. My well-being testimonial, I call it a series of miracles. I'm writing this testimonial to let you know my experience with the well-being program. Now, this section is all about the before I lost the weight. I am 67 years old, married with 2 adult children and a grandson, 5 feet 8 inches tall, and I'm a vegetarian. For the past 25 years, my weight ranged between 255 and 265 pounds. I was diagnosed with type 2 diabetes 20 years ago, and my A1C levels have ranged from 6.9 to 8.3, with an average of about 7.5. Over the past 20 years, diabetes progressively took its toll on my body and mind. I became weaker, more tired, and had lower libido. Suffice it to say, my get up and go just got up and went. 3 years ago, I retired from teaching, and the couch became my throne. After years of low to normal blood pressure, it slowly crept up to about 138/88. My legs were pithing, and I felt swollen all over. Through their love for me, my family continued to express concern for my future. And we all prayed for the Lord to intervene. Well, he did. And now here is the afterwards. Through an amazing series of events, which I call miracles, my wife and daughter, who are therapists at Florida Medical Clinic, along with my son, encouraged me, and arrangements were made for us all to register into the well-being program. I complied. That's the first miracle right there. God is good. From the very first meeting, I realized that I was in the right place. Dr. Hull and her amazing, qualified, experienced team expressed the knowledge, understanding, compassion, love, caring, and empathy that just drew me in. I complied again, another miracle. I followed their many wise directions and advice, went on the keto diet, and the pounds began to drop off, another miracle, because I had tried many diets before and failed them all. It is now almost 3 months. Well, I guess now it's almost 4 months now without bread. That's amazing. Another miracle. The well-being team provided truth, encouragement, and support throughout the program. I began to look forward to the meetings each week. Another miracle. I am still on my way to reach my goals of losing 80 pounds but the story so far is as follows. I lost 45 pounds and about 5 inches from my waist. My A1C level is now 5.9, so my doctor discontinued one diabetes medication called glimepiride and reduced the other, metformin, by 1/2. He also discontinued my medication for GERD, that's omeprazole, since my symptoms had decreased. After not exercising for years, I am now walking with my wife 2 to 3 times per week. And 2 days ago, I walked a brisk 4.5 miles, another miracle. I now look at my feet in amazement as I can see between my toes. Well, there are many more miracles, but we won't be able to get every one of them in today. I want to say that everyone in my family who participated in the program lost weight. You know, my wife lost about 10 pounds, my daughter about the same also, my son lost about 20 pounds. And what is happening now is that we're all having a new normal of eating. And even when the coronavirus pandemic is over, I still hope that I'll be able to save as much as I'm saving now on my grocery bill. I thank the Lord for these amazing miracles, and I thank my wife and children and Dr. Hull and her amazing, awesome team. I pray that the Lord will keep me going and to own this new normal for eating and for my overall well-being. I am now a member of the tribe, and I have a new hope for my future. For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future. That's a quote from Jeremiah chapter 19, verse 11. I hope that this has been an encouragement to you all. Thank you so much for this opportunity.
Oh, thank you so much, Richard. Just beautiful. And I agree once again that Kelly and Kim and Mindy are phenomenal, and so much of the reason why you guys have the success that you have. Thank you for sharing. Thank you again for your vulnerability, and thank you for leading others. And we're so glad that you get to always be a part of our tribe, Richard. So we have talked about this already, and as I mentioned, and Melissa thankfully also brought up, you know, it is vital that if you guys are considering to join us and participate in the program, that you do come ready. Now, Richard, you know, he sounded like he reluctantly maybe joined us at first, but then very quickly started seeing success and was able to grab a hold and continue on. But we will need commitment from you guys. We have to let go of the excuses that we're just, you know, just gripping onto for so long. We have to let them go. When something is a priority, we make it happen. And we want to help you make this a priority. And I get so passionate about this because I see the Richards, I see the transformations, I see how so many people are muscling through life and not really experiencing the true joy of life. And it's not about the weight loss, but it's about everything combined that results in the weight loss. It's about the nutrition and the exercise and the sleep and the relationships and the stress reduction. And all of a sudden, this transformation takes place from the inside out. And that's why I affectionately refer to this as also my third child, because it's so meaningful to me. And my purpose is this, so much of my purpose. So while I would love to just breathe this into you, I need you to want it as well. So when you sign up, come in ready to be changed. Come to be active and engaged. Take notes, highlight the information that we're going to be teaching you guys. It just didn't just happen. We're talking hours and hours and hours of reading and researching and organizing and planning, and 2 years of this where we have really created a program that is effective. So take advantage of that. You will graduate in the 12 weeks practically with a minor in nutrition and psychology. And we want you to walk away armed with that information, so it not only helps you be successful, but you can be effective for the people around you. So what have we seen thus far in our programs? And you guys, this number here does not include our most recent program because we're still finalizing some of those numbers, but I'm happy to report that we're at least 500 more pounds onto this. But in the first 4 programs, we've had 3,262 pounds lost among 183 well-being graduates. And what the best part is the graduates from, you know, almost 2 years ago, the vast majority of them are sustaining that weight loss today. And that's the piece that's so fantastic. We can all lose weight. The bigger question is, can we maintain it, right? And once again, the real goal and the real joy is when the weight loss is no longer the ultimate goal you're looking for. It's just feeling and living better. And I can't really put a number on that one. But if we were to break down this 3,262 pounds among 183 graduates, that's 8% body weight loss. And guys, it only takes about 5% of body weight loss to change that trajectory to disease down the road. We don't need radical weight loss to offset disease, but 8% is quite a bit when you're talking about the importance of disease prevention and disease management. This was an average of 18 pounds per participant. Yes, we have some patients who lose just a few pounds, and then we have some who lose 75 pounds. Not everyone goes through the program only for weight loss. Some people don't really have much weight to lose. They really just want to optimize their health and well-being. So there is definitely a spectrum here. And once again, my goal for you is to sign up not for the weight loss and it just be the positive byproduct in the process. We saw about 3 inches off the average waist circumference, which we know there's a definite correlation between metabolic syndrome and cardiovascular disease and that waist circumference. So when we lose weight in our abdominal area, we are going to reduce our risk for cardiovascular disease down the road. And as I mentioned, we see reductions in blood pressure, and thus far, on average, it's about an 8% reduction in that systolic blood pressure. Now, when we break the tracks apart and we look at the ketogenic versus the low carbohydrate track separately, you can see that those doing the ketogenic track do tend to lose more weight. It was 22 pounds compared to 14 pounds. However, guys, once again, we need sustainability. We need long-term. I don't care how long it takes you to get to your goal, as long as you're still there in 10 years. So once again, don't harp on the differences here, but we do want to, make it clear for you and be very transparent. So let's talk about some of the laboratory data that we have seen change. So we talk a lot about diabetes and prediabetes. And, because I have quite a few patients going through this program, which, by the way, you do not have to be a personal patient of mine, but some of you are, I'm able to look at laboratory results pre and post programming, and we can see significant change in this A1C, which is that diabetes marker. The pre-program was an average of 7, and the post-program just 12 weeks later, 5.8. Guys, medications don't typically have this dramatic of a result. And it's funny, I have drug reps who come into my office and try to sell me their medications that, oh, by the way, there's a black box warning that it causes pancreatic cancer, but let's go ahead and start this medication anyways. And we don't see results with medications as successful as this. 17% reduction in an A1C, not through drugs, but by changes in your nutrition and exercise and sleep. There's no adverse side effect to that. And guess what? It is free long-term. The cost savings you guys will have long-term if you're going down that diabetes realm, I will tell you the medications are not cheap. Let's avoid that. This is an investment in your health and well-being and in your future. We saw a reduction in your blood glucose from 140 to 122, which is a 13% average reduction. The triglycerides that I mentioned that are the precursors to the lipids, pre-program 210, post-program 147. That's a 30% reduction. Once again, medicines don't typically have this type of result. And you can see here the normal range for the triglycerides is less than 150. And after going through the program, on average, they had hypertriglyceridemia, and then post-program, on average, we were now in the normal range. Cholesterol HDL ratio, this is part of that lipid profile and probably the most important number on this lipid profile. We want this ratio low. Pre-program was 5.2, definitely above goal, and then post-program now in the normal range at 4.7. And that's a 10% reduction, which may not seem like a lot, but let's not forget, guys, this is in a 12-week period. And then here I'm going to share with you a few specific patient examples. That this is one individual, we're going to call him Josh, who went through the program. He lost 74.8 pounds. We can round that to 75. He lost 8.25 inches in his waist circumference. An A1C went from 5.6 to 5. Triglycerides 194 to 142, a 27% reduction. And we saw a pretty significant drop in his blood pressure from 132 over 88 down to 116 over 66. Another tribe member, we'll call him Steve, lost 35 pounds, which was an 18% reduction in his body weight. 18%, that's significant. His A1C was diabetic at 6.5 and post-program at 5.3, 18% reduction as well. And his glucose, his fasting blood sugar, went from 198 to 104, which was a 47% reduction. In the midst of all of this, while we dropped these numbers, we got him off of a blood pressure medication, discontinued his statin cholesterol medication, and reduced his diabetes medication in half. And then lastly, let's talk about Susan. She lost 20 pounds, which was 10% reduction in her weight. Her A1C went from 11.8 to 11.3. I want to like camp out here for a minute. 11.8 to 6.3. I was like floored when I saw her post-program results. That was a 47% reduction, 0 medication. I had a patient today who new diagnosis of type 2 diabetes and, you know, was obviously kind of a deer in headlights. What do I do? Oh my gosh, what does this mean? And he asked me, you know, is it possible that I can reverse this without medications? And I said, absolutely, you can reverse without medication. It does take work. It does take discipline, but it can happen. And then lastly, this person, their blood pressure went from 148 over 81 to 110 over 71, 26% reduction in that systolic blood pressure. Hypertensive, now below normal blood pressure. Phenomenal. And then, as I mentioned before, we like to really focus on the non-scale victories. This has been an evolution for myself and the team, really learning to more so focus on things beyond the scale because, you know, we're like you too. We understand that. We want to see those numbers change, but what we gain is so much greater. So this particular person said, my back pain is gone. I no longer have chronic stomach issues I was plagued with. Next, improved cognition. My focus has improved greatly. My work performance is better than ever. Reduction in headaches and migraines. My chronic headaches are far less frequent and way less severe. For those of you who have suffered from chronic headaches, you know how debilitating that is. You know how that takes away time from work, time from family, time from joy. If we can just reduce those headaches even by 20%, that is a tremendous win. New friendships. I never thought I would make lifelong friends. Once again, like this unexpected like blessing that happened throughout the program. Improved self-image, one that I love significantly. I'm more confident, actually feel more comfortable in my own skin. We are, of course, always our own worst critic, and it's just so beautiful to see people flourish in their confidence and just their joy within themselves. Reduced medications. I'm no longer using insulin to manage my diabetes. Yes, I'm happy to report that we've been able to get diabetics on insulin, off all insulin going through the program. Now we have to do that safely and monitor things closely, and that's where Mindy is also really helpful, but that's what we're here for. We're here to hold your hand and coach you through this process. And then lastly, hope for the future. I'm confident I can sustain this path for the rest of my life. I have the tools I need to truly live healthfully. And that's the piece that I love and I think I'm most proud of. Once again, we want this to be a forever change. We know this is an investment in your time and resources and financial, but we want you to walk away with a lifelong benefit. And then we're going to pause here again and we're going to hear from Darlene, our final testimonial. Darlene has been with me for a while. So Darlene, can you share with us your experience with well-being?
Yes, hello. I want to thank you, Dr. Hull, and the whole team for allowing me to share my story. Actually, my story starts when I'm 27. I lose 50 pounds. I've joined Weight Watchers. I weigh 128, and I'm a lifetime member, so all is well. However, the next 40 years did not go quite so well, and it was lose weight, gain weight, lose weight, gain weight. And finally, after about 40 years, I find myself doubled that weight at 27. And I'm just at a self-talk where that's it. I can't lose weight. I'm not going to pay for another program. I'm going to just enjoy life and it's going to be okay. That worked in the 60s, but all of a sudden I turned 70. I've had 2 abdominal surgeries in 1 year. The second one created some health issues. I went into AFib. My numbers were all off. After surviving that quite well, after 12 weeks, then I find out I need both knees replaced. And it's just like, you got to stop and change the self-talk. Got to look real. And of course, I am a patient of Dr. Hull's, and I know her passion, and she does have a passion along with her team for this program. So in January, I started the program, and that was the best choice I made for myself. Not so much for the purpose of losing weight, but for just becoming a healthier me. I have learned so much from this very well organized program. And I have a whole different mindset. I have Aldi is probably one of my favorite grocery stores. I go in and I get excited over looking at what's the vegetables and the fruit. And I can walk past all of those breads and cookies and snacks and cereals. And then I'm off to look and read labels. That is not something I would have ever done or even told you I was interested in doing. I am happy to say I have lost weight. I've actually lost 2 pant sizes at this point, and I just feel like I have a mind that's able to think. I'm no longer in a fog. And I just think my journey is still in a stage where it's not finished. I will still continue. I think the support of Mindy has been phenomenal. It's great to know you can talk to someone and you feel safe in what you say, and you're going to have that support. And I think that Dr. Hull and you and the Kim and Kelly and Mindy wear this badge that says, I'm here to help you. And so thank you very much. And one of the things that I did do too was I took a little calendar and I put messages into myself. And I put those in before I actually started the program. And I had things like believe in yourself, keep on going, breathe. And if it's not now, then when will it be? So thank you so much for allowing me to be in the program.
Oh, thank you so much, Darlene. And I love that you commented that it's kind of like your palate has adapted through this process. And that's the goal, guys, that we get to the point that we do crave those vegetables in the produce section and can simply walk by the crackers and cookies and breads and not think twice of it. And that's the happy place to get when now you crave healthy foods. And it is a process and it does take discipline in the beginning, but it does happen. Thank you so much, Darlene. Thank you to all of you guys for sharing your experience and being vulnerable once again to encourage others to go through this program with us. We're so grateful that you guys shared with us and your trust throughout the process. And we can't wait to continue the relationships in the ongoing program. So I'm going to switch gears here and I'm going to let Kelly talk about the kind of different program options that are available. So thank you, Kelly.
Of course. Okay, so the first option we have is our well-being on Tuesday evenings live. This is your in-person class from 5:45 to 7:30 on our Wiregrass campus. And we look forward to start on June 9th. If you register for this version and you cannot attend one of the Tuesdays, you will have access to the recorded webinars. Those will be emailed to you, so there is no excuse. You will get all the information that you need. Your registration with this program includes pre and post program measurements, your 12 interactive group sessions, a nutritional resource guide, weekly program notes printed for you so you have that ready to go when you get to class, sample meal plans, a digital food scale, like Dr. Hull mentioned, our private face group page, 6 weeks of group fitness training, your motivational health coaching. We do a really fun live grocery store tour and we touched on the cooking demo. You will also have access to mindfulness workshops with Kelly Crowe and Pathways of Florida. You'll have opportunities to have your blood ketone levels tested in class. And then again, also the well-being ongoing program. Our next option is our Wellbeing Virtually program. This is offered via recorded webinar sessions, and these are delivered on Thursday afternoons via email starting June 11th. In this program, you receive the 12 recorded webinar sessions, live additional Q&A webinar sessions. So just like we are right now on a live webinar, we will have these available throughout your 12 weeks so that you have that opportunity to ask and answer questions. Your nutritional resource guide comes to you digitally, as well as your weekly session notes. You have a virtual grocery store tour. You also receive the sample meal plans in the private Facebook group page. You'll get to participate with fitness via our virtual fitness classes. You have access to the same mindfulness workshops with Pathways of Florida, and you also have access to the Wellbeing program. If you are interested in registering for our next program that starts in June, this is the way to do it. We have QR codes on the screen for you right now. You can simply open the camera on your phone and either scan register me for live classes or register me for the webinar classes. You'll fill out a SurveyMonkey link with some information. And at the end of that, it will also prompt you for your payment. When you make your payment, it's going to ask you for an account number. And I need you to enter either Wellbeing Live or Wellbeing Web, depending on the program that you chose. Please note that payment does secure your seat in the program, and all payments are due by June 2nd. If you have a health savings account, some programs will cover the cost of the program. And what we can do for you is provide you a detailed receipt that you can then submit to your HSA. If you have family members that are joining the live program, that second family member is half off. If you need some more information on that, you can certainly contact me. And seats are limited. We actually, due to this COVID situation, we want to make sure that everyone is doing their part and is safe. So we have had to reduce the seating size in our class, and we only have 20 seats available left for the live class. We have unlimited registration for the webinar sessions. If the QR codes are confusing to you and you'd rather go to our website, the web address is right there, and the registration links are also located on our website.
And as far as it goes with the COVID situation, guys, we can't definitively make the decision today, just like everybody else is up in the air. It's a day-by-day scenario if we're going to be able to have that live in-person class on June 9th. If we're not ready, based upon the state recommendations, to have that group of people together, then we may have to start the live class 1 or 2 sessions virtually and then join together thereafter. Obviously, more to come in the next couple of weeks about that. We're hopeful that we'll be able to have a class live starting June 9th. Once again, we are limiting the number of participants for safety for everybody. And of course, if the state mandates that we cannot have a live class, then of course, we will only have the class virtually. As Kelly mentioned, as of now, we only have 20 spots available for that live class, but unlimited for the virtual class. So I hope that all makes sense.
This is just some contact information. If you would like to give me a call, that is my phone number there. You can also send me an email to that web address. If you are online right now and you have questions, you can go ahead and click through that question tab, and we would be happy to answer them for you. Here I see we have possibly one. Nope, not anymore. We answered that question.
So yes, you guys can type in your questions. Okay.
You can live out of state.
So the question was, I actually live in the state of Louisiana. Can I be in a different state? Absolutely. With the virtual class, you can be anywhere and participate. Okay, the next question is, I came in late. Will I be able to watch the entirety of the webinar? And the answer is yes. Kelly is going to email this webinar to you all after we're done with this live recording, so you can watch it again, share it with family members, coworkers, neighbors, because once again, anyone and everyone is, welcome to participate, especially since we have unlimited virtual spots.
Yes, look for that email sometime tomorrow morning.
Next question is, I may have missed it, but where are the virtual fitness classes done and how often? So we will be doing them on the Facebook page. And once again, it's a private Facebook page just for our live and virtual participants. And they will typically, we'll probably have 4 fitness classes for the virtual group. And if you're participating live, it's going to be 6 sessions live.
On Saturday mornings.
On Saturday mornings, that's correct, yes.
There is a question about a payment plan, and absolutely we can look at a payment plan. Go ahead and send me an email to wellbeing@floridamedicalclinic.com, and I'm happy to set something up with you.
Oh my gosh, I love this question. How easy is it to be successful in this program as a college student? I wish we had one of our program graduates here to share who went through this program in college, and guess what? She has lost 100 pounds, and she's graduated from this program now I mean, at least 4 months ago.
Yeah.
And she continues to be successful. She lives in a dorm. Well, right now she's not because of COVID, but up until COVID, she was living in a dorm and continuing to be successful through the program. So absolutely, you can be great even though you're in college. Will a person with gout be able to eat this type of diet? And the answer is yes, because it's not a high protein diet. We recommend an adequate protein diet. And when we help you figure out your macronutrients, you're quickly going to realize that you are probably eating more protein now than when we put you through the program. So absolutely, this is going to be a great remedy for gout, because weight loss and diet are probably the two best things.
There was a question about where will the live fitness classes be held. Those are actually in our Land O'Lakes office, 2150 Via Bella Boulevard, kind of 54 and Livingston is where the fitness classes take place. Every now and then we have to make an adjustment with location, but right now that's the plan. Anything else?
Any other questions? And if something does come up, after the fact, certainly email Kelly or call her on the information provided on this slide. We really appreciate your time and attention. I know this was a long open house, so thank you so much. And we can't wait to see how many of you join us for the tribe, and we can't wait to see how many lives we transform, right, Kelly?
Absolutely. Thank you so much for joining us tonight, and know that you can send me an email again, give me a call. I'm happy to help you get situated, and can't wait to meet all of you as you join the tribe.
Thanks, guys. Bye.